Health services research is really personal for me. I've been doing this work for over 20 years, and it's really informed by my clinical work. I still take care of patients with cancer and their loved ones, patients with leukemia and lymphoma, and making sure that the healthcare system works for them and they can access the care that they need in a timely, efficient manner is not only my clinical practice, but it's also my research. The Center for Improving Patient and Population Health at the University of Michigan School of Nursing really tries to bring a broad array of expertise to solving the vexing problems that we have in health and healthcare delivery. So we focus on three areas: patients with cancer, patients with serious illness, for example, those who survive an ICU stay and require follow-up care, and vulnerable communities. We have funding from the Agency for Healthcare Research and Quality to help us understand how we can improve care in the ambulatory or outpatient oncology setting, where over 80% of cancer care is delivered in this country, but we have very little quality measures and we have very little research being done in those areas. So we're trying to inform that, and our team here at Michigan, including many faculty members from IHPI, help us measure that phenomena, and now we're at the point where we're trying to disseminate our findings to clinicians who work in those settings to make sure that they're delivering the safest care possible. And that has a policy agenda because cancer care is very expensive in this country, and it's increasingly complex, and more patients are actually seeking services. So we need to make sure that the care we deliver is safe and efficient, and really health services research is where we're able to do that kind of work and make sure that patients, regardless of where they live, regardless of their social circumstances, can get the cancer care that they need that will hopefully improve their quality of life. I'm very proud to be the co-program director of the Merck Foundation-funded Alliance to Advance Patient-Centered Cancer Care. And that alliance is supporting 6 grantees across the country who are doing really innovative things to bridge the gaps in care that we know patients with cancer and their loved ones face. Things like navigating the cancer care delivery system after a new diagnosis, making sure that survivors get the recommended follow-up care. And the lens of the alliance is really to reduce disparities in care that we might see by race, ethnicity, by rural residents, socioeconomic status, et cetera. And the role of the National Program Office here housed at the University of Michigan is to support those grantees and amplify the work that they're doing so that it does have national policy relevance. IHPI has been pivotal to my career for many reasons. Number one is it connects important dots across campus and across the broader community for us to identify people with shared research interests or shared expertise that we can apply to a new and emerging field. I think the other piece is IHPI helps elevate our presence on the national stage through a variety of strategic mechanisms, the communication and dissemination efforts, the policy impact work. That's a great conduit for us to make sure that our work is really reaching the audience that it needs to reach.